Have you ever had the feeling that your body might be trying to tell you something important, yet you couldn't quite figure out what it was? What if something as subtle as a change in smell was your body's way of issuing an urgent warning about a serious illness, like cancer? It might sound surprising, even strange, but the truth is our bodies are constantly communicating with us. These signals may come in the form of aches, unusual sensations, or even odors. Sadly, we often dismiss these clues as unimportant or unrelated to anything serious. But ignoring them could cost you something irreplaceable: your time and health. Cancer is one of the most devastating diseases worldwide, and part of its danger lies in its ability to remain silent. Unlike illnesses with obvious symptoms, cancer often whispers its presence, subtly altering your body's chemistry, functions, and even smell. That's right. Your breath, sweat, or urine may carry subtle changes that serve as early alarms for certain types of cancer. Today we'll uncover 8 cancer-related odors that are often overlooked but could serve as crucial early warning signs. By the end of this video, you'll be equipped with the knowledge to recognize these signals, which could make the difference between early detection and a late-stage diagnosis. Stick with us until the very end. This may be the most important information you learn today: how cancer affects body odor. Before we dive into the specific symptoms and odors linked to different types of cancer, it's crucial to first understand how cancer affects body odor. This section provides the foundation for everything that follows, helping you better grasp why these changes occur and how they can serve as early warning signs. While we've included timestamps for those who may wish to skip ahead, we highly encourage you to take a moment to watch this part. By doing so, you'll gain a deeper understanding of how these subtle changes in your body's scent are connected to your overall health. This context will not only make the information more meaningful, but also empower you to recognize and act on these signs if they ever appear. So how does cancer alter body odor? The answer lies in the way cancer disrupts the body's natural functions. Cancer cells behave very differently from normal cells. They grow uncontrollably, hijack your body's resources, and release unique compounds into your bloodstream. These compounds, known as volatile organic compounds, VOCs, evaporate into the air and subtly change the way your body smells, including your breath, sweat, and urine. What's fascinating is that research has revealed certain cancers, like lung, skin, and bladder cancers, produce chemical markers that are so specific that trained dogs can detect them with astonishing accuracy. In fact, in several studies, dogs identified cancer in patients long before traditional medical tests revealed any abnormalities. This groundbreaking discovery has inspired scientists to develop electronic noses, advanced devices designed to mimic a dog's ability to detect these chemical changes. These innovations have the potential to revolutionize early cancer detection, making it as simple as breathing into a machine or providing a sample of sweat. Imagine a world where a quick, non-invasive test could give you critical health information in moments. However, until these technologies become widely available, the responsibility falls on us to pay attention to the signals our bodies are already giving us. A persistent, unusual smell, one that doesn't go away and can't be explained, may be your body's way of alerting you to an underlying issue. Recognizing these clues early can mean the difference between catching cancer in its early stages or facing it when it's already advanced. Understanding this connection might seem surprising at first, but it's firmly grounded in science. Our bodies are remarkable machines, constantly sending us signals, even in ways we might not expect. Taking the time to understand these subtle changes now could prove invaluable later. With this essential context in mind, let's move on to the 8 cancer-related smells you need to be aware of. 1. Musty smell, a warning sign of mouth or throat cancer. Imagine catching a musty odor similar to the smell of damp wood or mold on someone's breath. While it might seem like a minor issue at first, this subtle scent can be an early warning sign of something far more serious: mouth or throat cancer. The origin of this musty smell lies deep within the processes occurring in the affected areas. As cancer develops, it often leads to tissue necrosis, where cancerous cells begin to die off. This breakdown releases volatile organic compounds, VOCs, which are responsible for the peculiar smell. Additionally, cancer weakens the immune system, making the mouth and throat more prone to bacterial infections. These infections further contribute to the odor, creating a distinct, persistent scent that doesn't go away with regular oral hygiene. This odor rarely appears in isolation. Often, it is accompanied by persistent hoarseness or noticeable changes in the voice. Tumors affecting the vocal cords or nearby tissues can alter the way you speak, making your voice sound raspy or strained. Difficulty swallowing is another common symptom. Some individuals describe this sensation as feeling like food is stuck in the throat, a result of tumors obstructing the passage. Non-healing sores in the mouth or throat are another potential red flag. These sores may bleed or become infected, making it uncomfortable or painful to eat, drink, or speak. Additionally, individuals might notice unexplained ear pain. This occurs when cancerous growths press on nerves that are connected to the ears, creating discomfort that doesn't seem to have a clear cause. White or red patches on the inside of the mouth might also appear. While these are sometimes mistaken for harmless irritation or canker sores, they can actually be precancerous lesions that warrant immediate medical attention. The musty smell, while subtle, can also have a significant social impact. It is often noticeable to others during close conversations, which may lead to feelings of embarrassment or isolation. This can discourage individuals from seeking help, especially if they attribute the issue to poor oral hygiene or dietary habits. However, ignoring these symptoms could be a costly mistake. Diagnosing mouth or throat cancer early significantly increases the chances of successful treatment. Medical professionals may use biopsies, Connecticut scans, or MRIs to identify the cause of these symptoms. Once diagnosed, treatment options might include surgery to remove tumors, radiation therapy, chemotherapy, or a combination of these approaches. The stage of the disease and overall health of the patient will determine the best course of action. In summary, the musty smell of mold-like breath is not just a minor inconvenience, it's a potential life-saving clue. If you or someone close to you notices this persistent odor, especially when combined with other symptoms like hoarseness, difficulty swallowing, non-healing sores, or ear pain, it's crucial to consult a specialist without delay. Acting quickly can lead to earlier diagnosis, more treatment options, and a greater chance of recovery. Your health and well-being are worth the attention. 2. Decomposition odor, a warning sign of colorectal cancer. Colorectal cancer is one of the leading causes of cancer-related deaths worldwide. Yet, its early symptoms often go unnoticed or are mistaken for less serious gastrointestinal issues. Among the subtle but significant warning signs is a change in the smell of stool. This odor becomes unusually strong and persistent, resembling the smell of decomposition or rotting material. The cause of this odor lies in the disruption of the digestive process caused by colorectal cancer. Tumors in the colon or rectum interfere with the normal breakdown and absorption of food. This disruption leads to incomplete digestion and the release of toxic gases, which significantly alter the natural smell of feces. As these changes intensify, the odor becomes more pronounced and persistent, serving as a potential early warning sign of trouble. This unusual smell often occurs alongside other symptoms that may initially seem unrelated or mild. One common symptom is the presence of blood in the stool. Depending on the location of the tumor, the blood may appear bright red or cause the stool to take on a darker, tar-like appearance. The blood is a result of the tumor irritating or damaging the lining of the colon or rectum, and it's one of the most crucial signs to recognize. Persistent abdominal discomfort, including cramping or a feeling of pressure in the lower abdomen, is another symptom that may accompany the odor. These sensations occur as tumors grow and begin to press on surrounding organs or obstruct the intestinal tract. Changes in bowel habits are also common, with individuals experiencing unexplained constipation, diarrhea, or alternating patterns of both. These changes can create a sense of urgency or incomplete evacuation, leaving individuals feeling as though their bowels haven't fully emptied. Unexplained weight loss is another critical symptom often linked to colorectal cancer. As cancer develops, it diverts nutrients and energy from the body, leading to a gradual decline in weight and overall vitality. This weight loss may occur even without changes to diet or activity levels, making it a concerning and often overlooked sign. One of the challenges with colorectal cancer is that its symptoms frequently overlap with other, less severe gastrointestinal issues, such as irritable bowel syndrome, IBS, hemorrhoids, or food intolerances. This similarity can cause individuals to dismiss their symptoms as minor or temporary. However, when these changes, especially the decomposition-like odor, persist over time, they should not be ignored. If you notice these signs, including the characteristic change in stool odor, consulting a doctor is vital. Diagnostic tools like colonoscopies, stool tests, and imaging scans can help identify abnormalities in the colon or rectum, allowing for early detection. The good news is that colorectal cancer, when caught early, has a high survival rate and can often be treated successfully with surgery, chemotherapy, or radiation therapy. 3. Sweet, unpleasant smell, a warning sign of breast cancer. Breast cancer is one of the most common types of cancer globally, affecting millions of people each year. While it is often associated with more recognizable symptoms like lumps or changes in breast shape, an unusual sweet yet unpleasant smell can also serve as an important warning sign, particularly in more advanced stages of the disease. This distinctive odor often originates from open wounds or ulcers that develop on the skin due to tumor growth. As cancerous cells multiply uncontrollably, they can cause inflammation and tissue damage in the affected area. This, in turn, creates an environment where bacteria thrive, leading to infections. The combination of tissue necrosis and bacterial activity produces volatile organic compounds, VOCs, responsible for the sweet but unpleasant smell. The odor is often accompanied by other symptoms that should not be ignored. Lumps in the breast or armpit are the most recognized early sign of breast cancer. These lumps may feel hard, irregular in shape, and are often painless. Changes in the skin texture, such as dimpling or puckering, can also occur, giving the skin a texture similar to an orange peel. Nipple abnormalities, such as unusual discharge that may be bloody or clear, and persistent pain or tenderness in the breast, are additional warning signs. Sometimes the skin over the affected area may appear red, swollen, or unusually warm to the touch. In advanced cases, open sores or ulcers may develop, which are often the source of the odor. Unfortunately, this sweet smell and other symptoms may be overlooked or mistaken for less serious conditions like simple infections or poor hygiene. This can lead to delays in diagnosis, reducing the effectiveness of treatment options. If you notice this unusual odor, especially when combined with other symptoms, it's critical to consult a healthcare provider immediately. Early detection of breast cancer dramatically increases survival rates and opens up a wider range of treatment options, including surgery, radiation therapy, and targeted therapies. Ignoring these signs could allow the cancer to progress, making treatment more challenging and reducing the likelihood of a full recovery. 4. Sulfuric breath, a potential sign of stomach cancer. The persistent smell of sulfur, often described as similar to rotten eggs, can be a potential indicator of stomach cancer. While bad breath is a common occurrence caused by various factors, this specific sulfuric odor, when combined with other symptoms, may point to a more serious underlying condition. This odor originates from disruptions in the stomach's ability to digest food properly. Cancerous growths in the stomach can interfere with the breakdown of food, leading to the release of sulfur-containing gases during digestion. These gases can rise up the esophagus and escape as a foul-smelling breath that doesn't go away, even with good oral hygiene or dietary changes. Stomach cancer is often accompanied by additional symptoms that reinforce the need for medical attention. Persistent abdominal pain, usually described as a dull ache or a burning sensation, is a common early sign. A constant feeling of fullness after eating even small portions, known as early satiety, is another hallmark symptom. Other warning signs include frequent nausea or vomiting, which may sometimes contain traces of blood, and unexplained weight loss due to the body's reduced ability to absorb nutrients. These symptoms are often mistaken for gastritis, acid reflux, or other benign gastrointestinal conditions which can delay diagnosis. If you notice a persistent sulfuric odor on your breath, particularly if it is paired with the symptoms mentioned, seeking medical attention is critical. Diagnostic tests such as endoscopy, imaging scans, and biopsies can help identify stomach cancer at an earlier stage, increasing the likelihood of successful treatment. 5. Rotting meat smell, a warning sign of skin cancer, melanoma. Skin cancer, particularly melanoma, is one of the most aggressive forms of cancer, and in some cases it can produce a distinct odor resembling rotting meat. This unsettling smell is caused by necrotizing tissue in cancerous lesions, which release compounds that generate this unpleasant odor. Melanoma often begins as changes in existing moles or the appearance of new abnormal spots on the skin. These spots may become raised, discolored, or develop irregular borders. Over time, untreated melanoma lesions can break down and form open wounds or sores that fail to heal. These sores provide an environment for bacteria to grow, contributing to the characteristic smell of decay. This odor, while distressing, is often overlooked or dismissed. It can occur in areas of the body that are hard to see, such as the back or scalp, making self-detection more difficult. The smell may also be mistaken for poor hygiene or minor infections, delaying a proper diagnosis. Other symptoms of melanoma include rapid changes in the size, shape, or color of moles, and the appearance of spots that itch, bleed, or crust over. Some lesions may feel tender or painful to the touch, further differentiating them from harmless skin abnormalities. If you notice persistent sores, changes in moles, or an odor reminiscent of rotting meat, it's essential to consult a dermatologist or oncologist immediately. Early detection of melanoma can significantly improve treatment outcomes, often allowing for a full recovery with timely intervention. 6. Ammonia-like urine, a warning sign of kidney cancer. Kidney cancer often develops silently, with few symptoms in its early stages. However, one unusual sign that may appear is a strong ammonia-like odor in urine. This smell occurs because cancer impairs the kidney's ability to filter out toxins efficiently. When the kidneys are compromised, urea and other waste products accumulate in the body, leading to the pungent ammonia odor in the urine. Other symptoms often accompany this change. Blood in the urine, which may appear pink, red, or even cola-colored, is a major warning sign. Persistent lower back pain or a dull ache on one side can also signal kidney issues, particularly if the pain has no apparent cause. Intense fatigue and unexplained weight loss are other common symptoms as the body diverts resources to fight the growing cancer. Unfortunately, many people dismiss these signs as minor urinary tract issues or dehydration. This delay can allow the cancer to progress unnoticed. If you notice persistent changes in urine odor, especially when paired with symptoms like back pain or blood in the urine, it's essential to consult a healthcare provider. Early detection of kidney cancer improves the chances of successful treatment and long-term survival. 7. Metallic odor, a warning sign of blood cancer, leukemia, lymphoma. Leukemia and lymphoma, two types of blood cancer, can cause a metallic odor that is often described as similar to the smell of rusty iron or old coins. This smell typically arises from changes in the body's iron levels and the chemical imbalances caused by cancer's impact on blood production and destruction. This odor may be particularly noticeable during sweating or after light physical activity. The chemical changes in the blood can also affect the breath, producing a faint metallic smell. While subtle, this odor can be a powerful indicator of underlying issues when combined with other symptoms. Blood cancers often present additional warning signs, such as extreme fatigue that doesn't improve with rest, recurring infections due to a weakened immune system, and persistent fever or night sweats. Swollen lymph nodes in the neck, armpits, or groin are also common, sometimes appearing as painless lumps. If you notice a persistent metallic smell in your breath or sweat along with any of these other symptoms, it's essential to seek medical advice. Early detection of blood cancers can significantly improve treatment outcomes. 8. Sweet fruity breath, a warning sign of lung cancer. A sweet, fruity odor in the breath can sometimes be an early warning sign of lung cancer. This smell is caused by the release of volatile organic compounds, VOCs, from cancerous cells in the lungs. These compounds are carried into the air with each exhalation, producing a distinctive scent that lingers. This odor is often accompanied by other symptoms that provide further clues. Persistent coughing, which may worsen over time or produce blood, is a major red flag. Difficulty breathing, shortness of breath, and chest pain are other common signs. Lung cancer may also lead to frequent respiratory infections, such as bronchitis or pneumonia, which don't respond well to treatment. Many people dismiss these symptoms as signs of common respiratory issues, but when combined with a sweet, fruity breath odor, they warrant immediate medical attention. Early detection of lung cancer can make a significant difference in treatment success and survival rates. Your health and the health of those you love are priceless, and taking the time to stay informed can truly save lives. In this video, we've uncovered the subtle ways your body may be signaling serious conditions like cancer. But our mission to spread awareness doesn't end here. We highly recommend you watch our next video, 9 Early Signs of Dementia and Key Symptoms Explained, a comprehensive guide. Have you or someone you know experienced any of the symptoms we discussed today? Share your experiences or questions in the comments below. And don't forget to hit the subscribe button and join our community at Health Insight Explorers.